first of all, thank you so much for having me to be part of this. I'm very excited. I'm a sexuality educator. I've been certified through the American Association of Sex Educators, Counselors, and Therapists. And my credentials are that I have a PhD in human sexuality, which I got when I was 62 years old. So I'm very happy and proud of that. And I'm on a mission. I'm on a mission to promote the sexual wellness of older adults, particularly those in marginalized communities, which we can talk about in a moment if you're interested. And I've been doing this work for about the last 10 years or so. And what I've realized is things are changing. When I was first doing my research for my doctoral dissertation, there was almost no research on older adult sexuality, except for the research about how they couldn't get it up, or they were too dry, or they were not interested, or all the negatives, what I call the problematizing side of sexuality as we age. But lately, in the last few years, there's been a real shift, and there's a lot more people doing research, and there's a lot more people interested in what I have to say.
What made you decide I want to switch and pivot careers?
Yeah, what a great question. And it's something that's open to all of us. It's available to any of us. I was able to, at the age of 55, retire from a 30-year career in the public sector. And I did a lot of different jobs, but it was always within the same pension system. So I got a pension. Very few people can say that anymore. I'm so grateful for that. And I knew that I was done with that work. I was the director of medical education and staff development in a really big psychiatric facility. It was a big hospital. We had like 500 patients, 1,500 people on staff. It was a huge place. It was a great job because it was very meaningful, but it was also a really hard job. And so when I got the opportunity to retire, yeah, I was ready, but I wasn't really ready to be done with work. I was ready to be done with that part of my career. And so I wanted to go back to school. I was always interested in what I think of as taboo topics. You could relate, I'm sure. These are topics that nobody wants to talk about. And certainly sexuality is one of them. And we have such a difficult time in our cultures here in the US having really frank and candid discussions about sex. And I knew that I could talk about sex, and it wasn't very hard for me, but I was the one that all my friends came to talk to about it. So I knew that I had some facility in this, but I didn't have a lot of background. So I decided to go back and pursue a master's in education in human sexuality that led to my PhD in human sexuality. And it was one of the greatest things I ever did. And I totally encourage anyone younger than me to write to me, and I will help you get the courage that it takes to go back to school. Because, Ty, everybody in my program was at least 20, 30, or maybe 40 years younger than me. And that's not easy, right? That was really hard. So I just feel really strongly that if you've got a passion to do something different, go for it. So older adults very often have to deal with something called ageism, this idea that once you hit a certain age, you're kind of wiped off. And Terit Gewurtz-Medan, who's a wonderful sex researcher in Tel Aviv, she coined this term that I really like called sexual ageism. The idea that you kind of age out of being sexual and that you're not seen as a sexual being. If you have a rash or a sore on your genitals and you go to your doctor and you're over 65 or 70, they're probably not going to ask you if you're sexually active. And they're probably not going to assume that there's any kind of sexually transmitted infection going on because of this kind of blind spot that many people have, many people in the healthcare field have around who's kind of almost allowed to be sexual, who is someone you could imagine to be sexual. And Lucy Fielding, who's a wonderful writer and researcher and sex therapist, wrote a wonderful book about transsexuality that really, I think, kind of parallels a lot of what older adults are feeling. And that is that Lucy says that there's this kind of erotic privilege, and the erotic privilege is who you can imagine a sexual being as. And they've got to be white, cisgender, heterosexual. Lucy says thin, tall, and between the ages of 18 to 35. Now, 18 to 35 is a very narrow age group, right? So I'd say between sexual ageism and erotic privilege, other researchers have really answered this question better than I can. And that, we ought to really consider how important it is for older adults to be seen as fully sexual human beings. And what I often say to people who are older who come to my classroom, I do workshops in senior centers and senior living communities, and I have a great time. I always play bingo the night before and try to win as much as I can and have a good time with people. And I learn about their communities, but I also tell people that sex is a fundamental human right. And whether you're having sex at a later age or not is not usually dependent upon your sexual functioning, although there are sexual function issues. And certainly good mental and physical health is important. But you know what the research has shown, Ty? That it's more indicative of sexual function at a later age or sexual behavior at a later age when you look at access to a sexual partner and positive attitudes around sexuality. And I think that those are really important indicators to tell the rest of us that we need to be looking at grandma and grandpa in a different way and remind ourselves that they too can have intimacy issues, relationship issues, and issues around desire and arousal, and just the same as their younger counterparts.
So would you say that the research is saying nothing really changes, or I don't think I quite understood the markers that you.
Well, there are certain biopsychosocial changes that occur as you age, of course. For instance, there are erection differences, there's lubrication differences, there's orgasmic differences, there's desire differences. But those aren't the only indicators. And if we get stuck on just those, then I think we miss the whole social and emotional side of what it means to be older and interested in sex. So, for instance, for a lot of people, penetration just doesn't work so well for them anymore. Either the penis doesn't maintain or retain an erection as long as the person would like, or maybe the vaginal walls are very thin and there isn't as much lubrication because of lack of estrogen that doesn't allow the Skene's glands to create as much personal lube. And so there might be tearing or scarring or pain with penetration. But there's a lot of other possibilities. And if intercourse is not a possibility for you because of pain or because of inabilities, then there's other ways that people can have a lot of fun sexually. And one of them is called outer course. That's not a term that you'll read in the Webster's Dictionary, but outer course is all of the possibilities of sexual pleasure that don't have to do with penetration. And when I see older adults, they're telling me how they're still sucking and licking and grinding and tossing and flogging and binding and having a great old time, and not necessarily having to describe sex as just this one box of penetration.
This is really interesting to me. So what you're saying is that, of course, as the body ages, things change in certain areas for some people. Granted, I have also, I know people who have described that not much changed for them, even after they went through these changes like menopause or whatever, and they're in their 70s and they're still functioning very similarly. So it depends on the body, but what you're saying is just because the body changes a bit doesn't mean that the desire or
Right,
the
right.
the just being sexual in general changes. And so those sexual needs still need to be met in that person. And
Right.
do you feel like, I have a few other questions I want to tag on to that, but I just want to ask quickly, what is the effect of feeling as if um, society has written older groups off as
Mhm,
non-sexual? Is that
mhm,
internalized? Does that make people maybe you've talked to feel less sexual, or is it just hurtful, or what's some of the feedback there
mm,
of,
mm,
of that?
I love that question. Thank you. There's a great research article about this just recently, the title of which was Not at My Age. And this idea was, well, at my age, maybe I'd rather watch TV, or at my age, maybe I'd rather do the laundry. You know what I'm saying? Like this kind of like, I'm over that. That was then, sex was great then, but not anymore. And for some people, that's absolutely their reality. And in this article, what they found was that sex as you age is a multifaceted kind of experience, that not all people are going to be talking in the ways that I talk about sexual pleasure in terms of their aging bodies. Other people might feel like it's just not there for them anymore, whether they've had trauma or grief or loss or difficulties or surgeries, right? There's so many possible things that may have just turned their mind away from their sexual life. However, for those people for whom sex is still part of their need and desire and 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 pleasure, because I'm a pleasure focused sexuality educator. If pleasure is part of their zeitgeist, then what I tell them is, don't worry about the body parts that aren't working so well anymore. You can still get around it. There's toys, there's lube, there's pillows, there's lots of different positions, and there's lots of possibilities for you as long as you have willingness in your head to change your idea about what sex used to be. And I often say to people, don't get in a rut, because what used to work may not work anymore. And so as long as you can have a few other possibilities in your head, then you can derive as much pleasure as any young person. And the other thing I want to suggest to you also is that we've got a real mental health crisis going on in our society right now. Isolation is a big public health crisis, and our U.S. Surgeon General has been talking about this. And I love that he's really lifted this up, because we've been through COVID and people were stuck in their homes, particularly older people, scared to go out, needing to feel safe, but not really feeling healthy, right? This interesting dichotomy between safe and healthy. And yet, a lot of people are also on SSRIs, antidepressants, anti-anxiety medication. And you know what's one of the important side effects that many psychiatrists and psychologists don't tell people is that SSRIs will dampen your sense of desire. And so, very often when people come to talk to me, they say, I just don't feel it anymore. The first question I ask is, well, tell me, are you on any other medication right now? Because that could really limit your internal physiology in terms of feeling desire. So I just wanted to mention that, because it's a really important thing for any generation, but particularly for older people who are feeling very isolated.
I'm glad you did mention that. I think I've had one other person mention that on the show, and that's it. And I think it's actually really important because the research shows and the data shows, from my understanding, that it is highly possible and almost likely that the SSRIs will affect your sexuality or sex drive on some level.
Right. I mean, think about what SSRIs do. So your SSRIs are basically allowing you to not have to go down as much, but then you also don't go up as much. So you're here more. So the up is the part that I'm concerned about, because you're not feeling the excitement, the desire, the appetite up here. I don't even think it's sex drive anymore. I think for some people, it's just they're not feeling the desire for anything. And so SSRIs will dampen both the highs and the lows and keep you at a more equal, kind of stasis. And so all the data shows that we need to really be more thoughtful when prescribing medications for folks and letting them know that there may be some secondary side effects.
What would you say are some of the biggest misconceptions about older people when it comes to sexuality? And I would say that the biggest misconception is probably one we've kind of touched on, which is that they're not sexual anymore.
Right. Thanks for that question, Ty. It's so important. And it's not one that is often asked. I want to tell you a story. I was giving a talk at a senior living residence once, and most of the people in the audience were people who work there. So they were personal care attendants or certified nursing assistants. They were people who worked in dietary or maintenance. They're lovely people, and they work with older adults all the time. And one guy raises his hand, and he's in his 20s, I guess, maybe, late 20s. And he says, the couple that lives on the floor where I work, they sleep in separate single beds with a table between them. And I don't think they're having sex. And I said to him, you never know. How do you know that they don't plan their sexual encounters with each other for a period of time during the day where their meds have just kicked in and they want to have fun together when they're not feeling any arthritis or chronic pain? Or how do you know that they used to sleep together, but she hogged all the pillows, or his toenails were getting too sharp, and they decided we just don't want to sleep in the same bed together, but they're still having fun, having sexual pleasure together at different times? And he looked at me and he was kind of perplexed. Because you see, most people in their 20s and 30s, if they think about older people having sex at all, it's kind of like, I don't want to think about it, or it's gross, or I can't believe it, or as Lucy Fielding said, it's unimaginable. And so I'd suggest that we need to have a wider lens, a bigger perspective. And I've been trying something out. So I'll try this out on you today, Ty. So I ask older adults when they come to my workshops. So sometimes I teach the staff, sometimes I teach the older adults themselves. So when the older adults come to my workshops, like at the senior centers, I say, try substituting the word beautiful for the word aging, right? So instead of saying, oh, my aging body, or oh, my aging back, or oh, or my wrinkles, whatever it is, how about saying my beautiful body, and change the tone of what you're saying? I also ask people to wake up each morning and take a little body scan before they get out of bed to notice what hurts. Is it your hip? Is it your knee? Is it your neck? And I do this myself, so I know this is a really important one that can work. And every morning I say, I love and I fill in the blank with the part of the body that hurts that morning. And it's not always the same, right? And sometimes it's a lot of parts, and sometimes there's too many. Now, it hasn't changed the pain at all, okay? I'm not here to tell you I've had this magic wand and now every day I say I love my neck and I don't have any neck pain. I'm not saying that. But what it does is it changes the narrative here inside my head so that my personal narrative really counteracts that global narrative about my aging body, because it's a lot to counteract. And so when I do that activity in the morning, or when I suggest to older adults, change the word aging for the word beautiful, it just somehow, it does something different. And I noticed There was a full page ad in the New York Times magazine last Sunday that had a beautiful older woman as the model for a handbag. And I thought, right on, we're changing. We're really changing. And you see that around many advertisers now. You're seeing fat bodies, you're seeing darker bodies, you're seeing kinkier bodies. You know what I'm saying? You're seeing bodies that don't generally conform to the male gaze or that sort of heterosexual white male gaze. And so I think that I'm not going to be the one who can change all that narrative. But I think if I speak to enough people, that's why I love teaching groups of people about sexuality as they age, because a little light bulb turns on for people. They say, oh, I'm not the only one. Another misconception is that if I am sexual and I'm older and I'm a woman, or if I identify as a woman, I'm a slut. And if I'm a man or if I identify as a man, I'm a dirty old man. Pretty negative stereotypes, not ones that I want to embrace all the time. And so I'd say just by changing the narrative, we can maybe begin to change some of the ways people see older bodies and see them in a more sexual light.
Those exercises you gave were really beautiful, to use your word. And actually, I'm going to start doing it myself because,
Yeah, great.
yeah, I mean, just to change the narrative, like you said, of something being negative to it being beautiful or just part of life. Um, this is because even I can relate to that. Sometimes I wake up and my knee hurts. You know what I
Right,
mean?
right,
That's like
right,
actively, I have a knee injury and it hurts.
right, right.
Or something is going on, and so this points further to the fact that it's just maybe a stage in life that changes, but we're still very much the same.
Sure,
We're
sure.
human beings. There's maybe not a lot that changes other than different phases, I think.
Yeah,
And phases
right,
don't even
right,
always have anything to do with age. Sometimes phases, you could be going through the phase as a wife and mother at 45 or at
right,
25. It's just,
right,
you know,
right. Right.
um,
And also Ty, I think I don't know if you've dealt with this on the show before, but body image stuff comes up for everyone at every age. I when I was a teenager, after I hit puberty, in my early teens, I hated my body. I felt like my body was, you know, just my enemy. It wasn't good. It wasn't right. And for anyone who's ever felt like their thighs are too big or their butt was too big or their belly was too big or their breasts were too large or their penis was too short or too wide or their lips were uneven, whatever it is, or if you were feeling too light or too dark or too nappy or too straight or too kinky or too unusual, all of those parts of people get trodden down. And I think at any age, we have to combat this kind of negativity about our own bodies. And so I love that you want to start doing it now. Do it now because you've got a lot of years ahead of you, I hope, and you want to continue your vitality and to express your sexual vitality without loving your body is really hard. It can be done for sure. I'm not saying it can't, but when you get older, it's really important. And here's another thing I wanted to tell you about. An older woman I think she just turned 80. Her husband had died about 10 years ago, and she was living in assisted living, and she met a guy, and he was also around the same age. And they started to like each other. And she said to me, we want to have sex, but how do I take my clothes off in front of someone who's never seen me younger? Right? Because her idea was maybe if they knew each other for 40 or 50 or 60 years, it would be more gradual. It wouldn't be such a shock. So I said, Adele, here's what you do. Take your clothes off first. Put on something you really like. Get into bed first. Drop the lights. Don't have bright lights like this. have a candle burning, and have him get into bed after you. And when you look at each other about a quarter of an inch away from each other, he's not going to see anything that you don't want him to see. He's going to look into your eyes. He's going to look into your soul, and he's not going to see any rolls or sags or bags or any part of you that you don't feel proud of. He's going to look right into your soul. And that's where you begin. And she thanked me because she realized that, of course, she could do that. She was afraid that she was going to have to stand naked in front of him and be really frightened. And, for an older person to be sexual, it doesn't just happen spontaneously. I often tell people you got to be prepared and you got to plan. And for her, she had to make a little plan. And now she's been with him for, I don't know, it's been about 4 years now. And she winks at me every once in a while. So I think it's working. I think she's doing okay. And I see her probably about once a month when I go visit that facility. And so I would suggest that a story like that can give us some optimism. It can give us some hope. And it can give us some new tools and ideas about how we might enter a sexual moment with someone else. And if you're lucky enough to have someone else to enter with, and if you're lucky enough to have your own body that you want to be sexual with, more power to you. I really believe in solo sex for older adults as well. And masturbation is a great way to find yourself and find new places on you that you may not have known about because your body changes. That's the other change. You asked me about bodily changes before. So physiology changes in terms of some negatives, but on the positive side, some parts of the body that didn't turn you on when you were younger might turn you on now as you're older. And you've got to figure that stuff out. And you want to find out about it, particularly when you're alone. It's a nice way to do that. So you can do your own investigations.
Well, first of all, I think the work you're doing when you said about it being important to find hope and optimism, I think that's probably what the work you're doing is giving to, the people you're seeing. And so beautiful, bravo to you. I do
Like,
want to ask you though, speaking of masturbation and self-pleasure and exploring yourself more, obviously we're from Live Jasmin, which is a campsite. And I'm curious, where is the community that you are really serving, the older community, in when it comes to self pleasure, but also utilizing what's out there now, like campsites for connection if they are isolated, or even AI or that type of thing?
mm, great question. I think people are really starting to open up their minds to the possibilities of online pleasure. And so a campsite could be one of those. And I think Live Jasmine could be a place where people would be very interested. To tell you the truth, I haven't heard anybody tell me exactly where they go, but I do know that people are interested because I think there's still some stigma and people don't want to talk about it, even to me as a sex educator. But I always say to people, listen, at the end of my workshop, I'm going to hang around for a few minutes. You can ask me questions then that you may not want to ask in front of anyone else. So I'm gonna put it out there and see what I find out from people, and I'll let you know. I think the other part of it that you're talking about that's really important is toys, that people are really finding that there's a whole new raft of toys that are being developed for both disabled bodies, that there are non-gendered toys, and there are toys that are now being developed for older bodies. And I'm excited about that. And I show people demos of those toys when I do my workshops because they don't know. They've seen a Hitachi magic wand that's about this big, and it might scare them because that might be the last thing they want to introduce into their bedroom.
That could
But then
scare anyone, but yeah.
there's the cute little toys that are about this big, little butt plugs and little starfish. I mean, there's so many toys. So I would suggest that, there's a lot more discovery that has to be done, but we're living in a time where it's a good time to be an older adult because the industry is starting to really focus more on older adult sexuality. There's even lubes that are being developed for older bodies. And so, in terms of sexually explicit material, in terms of um, your company like Live Jasmin, I think one of the things that people are more interested in now is seeing representation of older bodies. And I'd love to really encourage people to begin to think about having more possible gray hair, more people with a little bit of wrinkles like I've got, just to really be that new image, that not all bodies are going to be virile and young and flat abs, because when you get into your 60s and 70s and 80s, it doesn't always look the same as you did when you were in your 20s. But there's some research out there that says that if in your mind you think you're younger than your actual chronological age, it actually means that your self-esteem is a bit higher. So I thought that was interesting. I used to think of it as like the opposite, that you were just like not dealing with your age. But anyway,
I need to look into that because in my
yeah,
mind, I think I feel a little bit older. So I don't know.
that's interesting. I used to do that. That's so funny. I used to feel older than my age, but now I feel younger than my age.
And you are really like high spirited and energetic when you're talking and you're like, I feel 17. I'm like, and that feels true. Like you know what I mean? Like you seem like
I
you
know.
have that vibrant energy of a 17-year-old. So
So there's something else that's really interesting about aging. That researcher I told you about before, who coined this term sexual ageism. Um, I was interviewing her for our podcast. We have this podcast called Our Better Half. It's about sex and aging. We call it Our Better Half. It's about sex in the second half of life. We call it Our Better Half. Anyway, that's our little line. But Ty, I was interviewing her, and one of her really interesting findings in one of her articles was about why older adults have sex. Now, it's a question you wouldn't ask younger adults, because why would you even ask? Of course they want to have sex. But anyway, again, a lot of ageism here. So she said she embarked on this really interesting research project to try to really get older adults to describe for themselves. And one of the themes that came up was, there were a whole bunch of themes, like makes me feel better about my body, makes me feel better about my mental health, makes me feel more attractive. Um, I have changed from getting sex to giving sex. That's interesting. And also, I've gone from lust to love, which is also interesting, right? But one of the most interesting ones to me was, it makes me feel younger. And I like that because I actually really relate to that. She said, well, I don't know about that. I feel like, I wish that, people would just feel their age. And I realized that was the difference between the researcher's eye, her gaze. She's a bit younger than I am. And I'm of the age group that she was studying. And I think that when you are actively sexual at an older age, you do feel a little bit of bounce in your step. You do feel a little bit lighter. And I'm a skier and I can't ski as fast as I used to, but I think that there's a way that, as long as I can keep myself moving and keep myself really feeling strong in my body, I do Pilates every day to keep my core really strong. And I think as long as I do that, I'm going to be able to live a long and pleasure-filled life.
well, when you said, people who are older that are still sexually active, it does put that bounce back in. To me, it makes sense. I think not just for people that are older, but for everyone,
Right,
because it's the life force. Like that sexual energy
right,
it makes life. It is the life force.
absolutely. And
Interesting.
there's a lot to be said for that. And Beverly Whipple and her colleagues a few years ago did a really great meta-analysis of all the reasons why sex is good for your health.
Oh,
It was such a cool article. And, amazing things like reduces the risk of heart disease and complications of heart disease, reduces the risk of two of the most common cancers, breast cancer and prostate cancer, reduces mental health problems, increases sleep and reduces anxiety, um, reduces pain. So, really interesting stuff, right? What we could say is that as you get older, there's an accumulation of loss. There could be loss of a spouse, or loss of income, or loss of employment, or loss of a child, loss of a body part through surgery, loss of your health, so many losses. Loss is an interesting topic, and I pair loss with, I like to think about dialectics and sort of you've got pleasure, but you've got loss. I like to I like to pair loss with discovery, that from loss comes discovery. If you have the possibility of another partner or yourself, there's a chance for new ways in which to find sexual pleasure.
Yeah, beautiful. I mean, that was absolutely beautiful. And I think discovery is actually a key word for everyone because
Yeah, yeah,
discovering ourselves sexually in whatever
yeah,
phase of life we're in,
yeah.
that is the key. Because you know what?
Totally,
Depending on the
totally,
phase, you may need to go through a different discovery process. Maybe
totally,
whether
totally.
it's through aging or whether it's through becoming a new mother or whether it's
Right.
from becoming newly single, discovering the new phase of life and discovering yourself and your sexuality in that process, I think is the work,
That's
right?
great. That's great. Tanya, you really hit on a lot of themes that I've been thinking about a lot lately. I wrote a book about LGBTQ older adults. And, for a lot of gay men, there's a real lot of stigma within the gay men's community about being older, that there's a real, sort of, you know, bias toward younger bodies and younger men. And for older lesbians, there's a real kind of sensibility that, they're not really supposed to be sexual anymore, that they did that when they were young, when they went through that phase. And for older trans people, a lot of younger people don't realize that there's a lot of older trans people in the world for whom sex is still a part of their lives and they still want to be sexual beings. But for all three of those groups, and also for bisexuals, let me say something about bisexuals who have been really relegated to invisibility in a lot of communities. For all four of those groups, I'd suggest that there's a lot of discovery that needs to happen to find the authentic self, and to find the authentic sexual self is even harder. And to uncover inside of oneself who you are sexually is a lifelong journey. It really is a journey that may take some real tough turns, but for someone who maybe was very vanilla in their early days and they realize that they just need a little bit more stimulation, impact play might be something very exciting that shows up for them in their 60s or 70s or 80s, but wouldn't have shown up if they weren't able to see themselves as a sexual being. And I really wonder about someone who's given up on their sexual side in their 60s, 70s, or 80s. All the empirical research says that people are still sexual in their 60s and 70s. And in my own, very anecdotal teaching, there's often somebody who says, see that woman in the corner? She's 92 years old and she's got 4 boyfriends. This happened. I swear this happened. Now, I don't know what she's doing with those 4 boyfriends, but I don't care. I'm just thrilled that she's got intimacy, that she's got romance, and maybe even some sex. Because as a really brilliant sex educator said the other day, I was at a conference, and Rochelle Frabata, who lives in Dayton, Ohio, said, intimacy doesn't always include sex. And sex doesn't always include intimacy. And intimacy is that place where we can be vulnerable with one another. And so if that 92-year-old is vulnerable with someone else, well, that is amazing. And that's an incredible feat at any age, but particularly when we get that age.
You know, that story about the 92-year-old in the corner that she has four boyfriends. I was smiling so big because, you know, my grandmother on my mother's side, she was that's what people would say to her about her. You know, she lived to be in her early 90s and she just always had these boyfriends and we would joke about it because these boyfriends were always younger than her and they just would do whatever she told them to do. And they really adored her, you know, but she would boss them around. And but like you said, now that I'm much older and in myself can see it from a fuller vision than just being a child or a teenager, you
Right,
know. And
right.
like
That's
you
great.
said, knowing that she was experiencing, you know, whatever form of connection, even into
Yeah, yeah.
years. And it truly did not stop until she passed away. She
So
always
great.
had boyfriends around that were just waiting on her hand and foot.
She's got it, Ty. You have to really remember her, right? When you get older, you got to keep her image in your mind.
I trust me to this day, even at my age, I'm like, I really need to go back and think about what this woman was doing because she really just, I mean, she had it. Yeah,
So
she
great.
had it.
That's so great. And there's something about sexuality as you get older which allows more joy and more laughter into your sexual moments. So I don't know if you remember, being younger and being so afraid of doing something wrong or not being the right kind of lover or oh my God, what am I going to make some sound or some smell that is not going to be allowable? I don't have permission to kind of stray outside of these very narrow confines. Well, when you get older, things happen. Sounds happen, smells happen, mistakes happen, things don't go right, things don't go up when they're supposed to, or they go down when they're not supposed to. But what I'm trying to say is you've got to have some humor and you've got to have some ability to laugh because when you get to be older and you have an opportunity to be sexual, all sorts of things can happen. And if you're willing to laugh through it, you can have a really wonderful time.
I think that's really beautiful. And on that note, my next question for you is if you could give one message or piece of advice to everyone in the world, everyone listening, about
Mm,
human sexuality or human connection, or even just aging as you've studied and researched and even experienced these things, um, what would that message or piece of advice be?
okay, great question. It's threefold. First part, when you're younger, pay attention to sex. Don't expect it to just always be there and always be easy. Second, put away your iPhone and put away any electronics when you can. Now, I understand this is not always possible, but when you want human connection and when you want to be with someone in a way where you might want to raise that relationship to a sexual one, focus on their eyes, look into their soul as much as you possibly can, and find out who they are and let them know who you are. And then you can open your camera and do whatever fun you want to do with your cameras. But first off, just notice who they are and be as present as possible. And the third piece of advice is really the same as the first one, which is be prepared to change. Be prepared to have life go in ways that you never thought it would. Had I known when I was 20 years old, coming out as a lesbian, I called myself a baby dyke back then. I loved having sex with all sorts of women and having a great time. Had I known back then that 50 years later, I'd be studying older adult sexuality and educating people on the possibilities of pleasure, my life has changed so much, and I never would have expected to be here where I am right now. And so be prepared for wherever roads you want to take your life on, wherever it leads you.
Beautiful. Thank you so much.
Thank you, Ty. This was so much fun.
Yes,
Oh
it
my,
was. It's beautiful.
thank you.